Good afternoon and welcome back to GP Video Podcast by Nadia. So today we are again going to talk about a topic and its 5 important points. So the topic again is that when you visit your GP, if you are a regular patient of that GP, then what are the 5 points that you should make sure that your GP doesn't miss doing them with you and you don't miss asking him or her to do it because GPs can be really tired, busy, overworked, and then because the time slot is always very limited as well, so it's not always possible to catch up with everything. But for a standard session, if you're going to see your GP, apart from your own questions, if you have these 5 things to be covered in every GP session, then it would be great. It will actually make sure that your continuous care you are receiving is efficient and effective. Number 1, always make sure that you tell GP about the medications that you are taking. So medication summary should be reviewed by the GP every time. If you are even if you are on vitamins only, you should tell the GP that I'm taking these vitamins and these are the strengths that I'm taking. So a medication summary should always be updated, and then if GP is making any changes, so that change should be reflected in the medication summary as well. So you should be very clear about what were the medications you are taking and what are the changes that have been made this time. So medication summary discussion, previous and next, is very, very important. Number 2, I know it's not always possible, but if it's okay, then always ask the GP to do your BP, heart rate and weight. Though everything is normal, like usually you don't have high blood pressure or low blood pressure, or your weight is not low or high. So height is always recorded once, and then we can always do weight every visit. If we can do weight, blood pressure and heart rate, that would be great. Okay. Number 3 is make sure that GP reviews your latest investigations, bloods and scans. So if you have done them recently, I want to check with him. Of course you will do it, but just make sure that the latest investigations are always looked upon by the GP. So your blood test results and your scans. Then number 4 is specialist reports. If there are any recent specialist reports that the GP has received, just make sure that you and GP review those reports together. Number 5 is, of course, plan what is going to happen. What is your homework to do? What does GP want you to do? If there is any task that GP has to do for you, like talking to a specialist, corresponding with someone or anything, the plan should be well crafted and you should know what is going to happen next time and when is your follow-up, which is the most important bit. So 5 important points. Number 1, your medication summary should always be updated. What have you been taking and what are the changes made for next time? Number 2, BP, heart rate, weight. Number 3, investigations, your bloods and scans. Number 4, specialist reports. And number 5, what's the plan and when is the next follow-up? Thank you so much.